Ichthyosis is a rare group of genetic skin disorders characterized by dry, thickened, scaly skin that resembles fish scales, hence the name, which is derived from the Greek word ichthys, meaning fish. The disease can range from mild to severe and may present at birth or develop later in life. Although it is not contagious, ichthyosis can significantly impact a person's appearance, comfort, and quality of life. Types of ichthyosis. There are more than 20 different types of ichthyosis, but the most common forms include Ichthyosis vulgaris. This is the most prevalent type, accounting for over 95% of all cases. It typically appears in early childhood. It is inherited in an autosomal dominant pattern, meaning a child has a 50% chance of inheriting the condition if one parent has it. Symptoms include dry, scaly skin, particularly on the arms and legs, with improvement in warm or humid weather. X-linked ichthyosis affects males more often because the gene responsible is on the X chromosome. Begins soon after birth or in early infancy. Characterized by large, dark brown scales, particularly on the neck, trunk, and extremities. May also be associated with other complications like corneal opacities or testicular problems. Lamellar ichthyosis. A rare, autosomal recessive disorder. Newborns are often born encased in a shiny, tight membrane called a collodion membrane. As the membrane sheds, large, plate-like scales form over the entire body. Unlike Ichthyosis vulgaris, lamellar ichthyosis persists year-round and requires lifelong management. Epidermolytic ichthyosis. Also known as bullous congenital ichthyosiform erythroderma. Characterized by blistering and redness at birth, followed by thick scaling. The skin is fragile and prone to infection. Harlequin ichthyosis. The most severe and rare form, often diagnosed at birth. Infants are born with thick, hard skin plates separated by deep cracks. Immediate neonatal care is critical for survival. Advances in neonatal care and retinoid therapy have improved life expectancy. Causes and genetic basis. Ichthyosis is primarily caused by genetic mutations that affect the skin's ability to shed dead skin cells. This results in a buildup of thick, scaly skin. Each type is associated with mutations in specific genes. FLG gene in Ichthyosis vulgaris. STS gene in X-linked ichthyosis. TGM1, ALOX12B, and others in lamellar ichthyosis. In rare cases, ichthyosis can be acquired later in life due to medical conditions such as cancer, kidney disease, or thyroid dysfunction, or as a side effect of certain medications. Symptoms and clinical features. The symptoms of ichthyosis vary by type and severity, but common features include dry, flaky skin, especially on the arms, legs, and torso. Thick, plate-like scales, which may be white, gray, brown, or dark in color. Itching and discomfort, caused by tight, cracking skin. Redness and inflammation, particularly in more severe types. Cracks in the skin, which may lead to infections. Overheating, due to reduced sweating in some forms. The face and scalp can also be affected, and in some types, the palms and soles may become thickened and rough. Eye problems, like ectropion, where eyelids turn outward, hearing issues from blocked ear canals, and restricted joint movement may occur in more severe forms. Diagnosis. Ichthyosis is typically diagnosed through clinical examination, by a dermatologist based on skin appearance. Family history, to identify hereditary patterns. Skin biopsy, to study abnormalities in skin cells. Genetic testing, to pinpoint specific gene mutations. Prenatal diagnosis is possible in families with a history of severe forms. Treatment and management. There is currently no cure for ichthyosis, but treatment focuses on symptom relief and skin care. Hydration and moisturizing. Regular use of emollients, creams, and ointments to keep the skin moist. Products with urea, lactic acid, or alpha-hydroxy acids help soften and exfoliate scales. Bathing and exfoliation. Frequent bathing helps loosen scales. Gentle scrubbing with a soft cloth or sponge can remove excess skin. Topical medications. Prescription creams containing retinoids, corticosteroids, or keratolytic agents may be used for severe scaling. Oral retinoids. For severe cases, doctors may prescribe oral retinoids like acitretin to reduce scaling. These drugs have significant side effects and are monitored closely. Infection management. Antibiotics or antiseptic washes may be needed if skin cracks become infected. Living with ichthyosis. Ichthyosis can affect daily life, self-esteem, and social interactions, especially in children. Support groups, counseling, and patient advocacy organizations play a crucial role in emotional and mental health support. Lifestyle tips include staying hydrated, using a humidifier in dry environments, wearing soft, breathable clothing, avoiding extreme heat and cold. Conclusion. Ichthyosis is a complex, lifelong skin disorder that varies widely in presentation and severity. While there is no cure, modern treatments and supportive care can help manage the symptoms effectively. Advances in genetic research and therapies continue to bring hope for better treatments in the future. Early diagnosis, regular dermatologic care, and supportive environments are essential to improving the lives of those affected by ichthyosis.